Sure. So my name is Dr. Asif Ali. I'm a clinical cardiologist at the University of Texas Health Science Center in Houston, Texas. I'm a preventative cardiologist and I have a special interest in health technologies and how they improve patients' lives. It's a great question. And in fact, I was just asked by a fellow at a talk that I just gave, and this was my advice. So number one, get your brand out there. Everyone has a brand. And you need to be able to really expand your knowledge base. It's not just in academia, but really looking at medical technologies, looking at journals, understand what RTCs are and how are you reviewing those journals and what does health outcome data mean? And hold companies, just like you do when you do Journal Club, hold these companies to a higher standard. There's a lot of noise out there and jargon out there, and you need to be able to shift through that. So the same approach that you did when you took your exams and you studied and you read journals, you were very knowledgeable in that sector. These are different verticals applying into that sector. You need to have that broadened knowledge. The only way to do that is put yourself out there, be part of research, and question everything, get that knowledge base, and go work with those technology companies and keep them at that high level of standard that you would just like you're taking care of a patient. So for the innovators who are out there, I would implore that you really get into the meat of what you're working on. So that means actually rolling up your sleeves, get in the trenches. Get in the trenches with the patient, with the doctor, with the mid-levels, with the front office and the back office. That includes the billing and EOBs and pre-authorizations, because it is so complex. It's like layers of lasagna. What you see on the top is just one layer. There's so many different layers, and unless you understand each layer and the complexities and how those layers interact, you're gonna be selling yourself short. Yeah, it's a great question. In fact, I had a great conversation with Pat Dunn on this. So I was working with Fitbit as a medical advisor, so I have a little bit of knowledge in this space. Consumers are the ones who are buying products. Physicians have their own FDA approved products like Holter monitors. We've been doing remote patient monitoring for many years, and cardiologists were really in the forefront of that. But now you have a shift, you have a paradigm shift where consumers are purchasing devices that may not be FDA approved, may not go through the rigors of medical grade devices. But yet the consumer is consuming that data. So the barriers are looking at and holding companies accountable that the data that they're actually connecting with the patient, that data is actually actionable to a doctor. There's not a day that goes by that cardiologists at the AHA don't have a patient that comes in with data from a wearable device, whatever that device may be. And the patients have certain expectations based on that data that they've collected. So it's a very hard discussion to talk to the patient to explain that the data that they may be collecting may not be actionable and may not be actually data that we can actually make a medical decision. And that actually can further cost the healthcare system, not save the healthcare system with the data that those patients are providing us. So data acquisition is extremely important, and looking at that data and then actually making sure the data that we're acquiring actually has a randomized control trial or has the vigors of FDA approved. And I would love for the American Heart to actually not really endorse, but create that bar. Say that this data with the seal is good enough to bring to your cardiologist. I really hope that's the vision of the AHA, to really hold companies accountable, make sure that patients also have the education awareness of the data that they're collecting, whether that's actionable to a physician.